Good morning, everyone. Nurse Tanya from Code Lavender here. I thought today we might talk about some off-label uses because it seems like that is a trend that we're seeing now, which kind of tells me that we're paying a little more attention to side effects, and that makes me happy. Now, the first one is going to be the most obvious. We're going to talk Viagra, which is known as sildenafil. Now, the original use for sildenafil was actually to treat angina and hypertension. However, what we discovered through side effects tracking is it also treats ED. So I'm sure we're all familiar with the little blue pill. That was its origin story. Now, the next one is kind of along the same lines. Nothing I need, mind you. We're looking at quite a hearty head of hair here. Minoxidil. I'm really bad with pronouncing the drug name. Rogaine. The original use was actually for peptic ulcers. Can you believe that? But they found, guess what? We get hairy when we use it. So they've rebranded it to be used for hair regrowth. Pretty cool. Rogaine. Number 3. Now, this one I will confess to using. Botox. Oh, yes. And I do remember back when I started as a very young, naive optician, so many decades ago, about using Botox. Not that I administered it, but it was used to treat strabismus, which is like a lazy eye, basically, or eyelid spasms, which people sometimes can suffer from those for weeks, months at a time, and it can become quite a distraction in your life. Now, of course, we all know what we use Botox for, which is wrinkles. But something else that we use it for, and I do use it for this, is migraines. There are people also who have Botox injected into their armpits for excessive sweating. And we will also use it for overactive bladder. So pretty cool there too. Now, the fourth one that we're going to talk about is AZT. Zidovudine. You got to watch just to hear me pronounce these things. AZT. All right. The original intention for this drug was to treat cancer. It's a type of chemotherapy, basically. However, now it is more commonly associated with the therapy for HIV and AIDS. So I don't know how they came about that one, except that maybe it's like a really great antiviral. All right. Number 5. We got metformin. A whole lot of people may not be familiar with that, but it is very, very commonly used now. The original use was to treat malaria and influenza. Interesting to note that now it is more commonly used for type 2 diabetes. It actually would be our first line that we would go after, would be the metformin. And it's also being studied for use in anti-aging. So I'm listening to that one. The last one for today is going to be GLP-1s. Everybody knows those more commonly as, for example, Ozempic. Now, the original use for this was, of course, as blood sugar regulation, much like metformin. But now we're using it to treat obesity, so as a weight loss medication, kidney disease, apnea. And here's one that I need to look into because this is just a really quick surface scratch, but alcohol addiction risk reduction. So I'm curious to hear what we're going to develop with that, if anything. That's all for today. If you have any questions or you have any comments, or if you want me to do a deep dive on anything that you're using to see if it had an original use that it's now being off-labeled for, drop a line.